Hospitals have had to re-equip themselves entirely with stronger beds, stronger hoists, stronger stretchers, wider doorways, stronger lifts to hoist them up and down, whatever. Bigger mortuaries, mega mortuaries where the doors are twice as wide and twice as long as they used to be. It is really a serious, serious problem.
Coming up on British Thought Leaders, I talked to Tam Fry about the impact of obesity on our society, our health service and our health.
We're losing £198 billion a year, and that is a huge loss to the United Kingdom. We are losing money hand over fist every day, and if these are not addressed, we will become 50% obese by the year 2050.
We ask where the responsibility lies for Britain's obesity crisis.
Eat this, drink that, eat this, drink that. Every billboard you see, every advertisement on television you see is, this is more delicious than that. And of course, to the people who, at a certain level, don't have the capability of protecting themselves against that onslaught, it's corporations, if you will, at their worst.
Welcome to British Thought Leaders, I'm Lee Hall. Today I'm sitting down with Tam Fry, Chairman of the National Obesity Forum. Tam, thanks for joining us.
You're welcome.
Can you start by giving us an idea of the scale of the problem of obesity in the UK and give us some figures?
The key figure you need to know is 63%. We've got about 30% of obese and we've got about 33% of overweight. And it's not stopped, it's continuing to go up. When you consider that in 1972, we had 2% of men and 3% of women who were obese. And it has escalated very fast in the first 15 years from 1972. It slowed down a bit, but it's by no means halted, despite every government saying we will put an end to obesity.
So why is this a problem? Can you talk to us about the health issues involved?
Yeah. First of all, walking around with a huge amount of excess weight is not comfortable for anybody. But the real danger is that obesity has a number of very serious health issues that it triggers. First of all, diabetes type 2. Most likely to get diabetes type 2. But also it stretches to heart conditions and to cancers. Some cancers, not all cancers. And those three, on top of obesity, send the cost of obesity very high. So in fact, what obesity is doing is basically treasuring a huge deficit for the United Kingdom, currently put at about £198 billion a year.
So what kind of strain is this putting on our health service?
Huge, because to look after an obese person in the community is quite expensive. Although at that point the GP will suggest weight loss drugs and whatever, and healthy eating and healthy exercise. But when it's become too much, it goes into hospital, and there obesity really does have a tremendous effect because it ties up a bed. And you have to remember that obesity is an entirely preventable disease. So what's happening is that beds are being occupied, preventing people who really need the beds using them, and that itself is an enormous cost. It's something like 2.5 times more expensive to look after an obese person in hospital than it is in the community, because the nurses, you have to have 2 nurses to cope. Hospitals have had to re-equip themselves entirely with stronger beds, stronger hoists, stronger stretchers, wider doorways, stronger lifts to hoist them up and down, whatever. Bigger mortuaries, mega mortuaries where the doors are twice as wide and twice as long as they used to be. It is really a serious, serious problem. And it has been that for now, certainly the last 20 years, when we got to a level where there were hospital admissions starting to build up.
Did the COVID lockdowns accelerate all of this?
COVID is not nice to obese people. Boris Johnson knew this directly because he came out of St Thomas's Hospital having had emergency COVID treatment and said, I'm going to declare a war on fat. I hadn't realized until I got into hospital how COVID affects fat people, and it is more difficult at that stage to help people out of COVID in the hospital because they're obese, and I'm going to do something about it. He was very, very lucky to emerge from hospital.
And putting aside the health issues, what are the societal and cultural impacts of the rising obesity?
Particularly in the street. Obese people are stigmatized, they are laughed at, they are not tolerated really very kindly in the street. And that's why they really do retire into themselves, and they tend to lock themselves away. Only the other day there was a story about the number of fire crews which are required on a yearly basis to hoist people out of their rooms with cranes and stretchers and ladders. There was a very famous case in Aberdare in Wales about 11 years ago by an enormous Welsh girl, and the fire crew had to break down the wall and the window of her bedroom, run a bridge from there to the street and drag her along and put her in a low loader and take her to hospital. About 100 men were used to cope with that particular situation, and of course it was hugely undignifying for the girl concerned. So it's got a mental aspect to it. It's such a disease that people thinking about it seriously would say, that's it, I'm not going to get fat. The problem, however, is that corporations are stacked up against them.
So you mentioned the figures in the 70s, the obesity levels were so much lower. What are the main drivers that have caused the changes?
Well, very simply, what happened was that the government in 1992 decided that it was going to do something about public health. And up until that stage, the United Kingdom had had no public health policy. William Waldegrave, who was the health minister at that time, wrote a paper called Health of the Nation. In it, he had a whole variety of issues which needed to be addressed. Obesity was only one of them. And he said, we're really going to do something about it. And the problem was that nothing really of consequence happened. The target at that stage was that by 2005, obesity levels would be 5% for male, 8% for female. Not a hope in hell did they get there. And when the Labour government came in 1997, it was deemed that, in fact, the scattergun approach of the previous administration had been such that there was never a chance of meeting the target. But I, Tony Blair, I'm going to do something about it. And there he first confronted the food industry, who said, don't touch us, we're so valuable to you. If you do anything to conflict with our trade, we'll just up and move our manufacturing base abroad. There will be thousands and thousands of unemployed. And Tony Blair basically threw his hands up and said, well, at least I'd like to do it if I could, but he did nothing.
I wanted to, before we get on to solutions, just look a bit at childhood obesity. Do you have some figures around that for us?
Yes, childhood obesity at the moment, there are 2 points which we know now, where children are measured at the first year of primary school and then the first year of secondary school, or the last year of primary school. And the 5% of children are seen to be obese at the age of 5, which is a terrible figure. But that has increased to 13% by the age of 11. So it's going up through school, through the whole of the healthy schools strategy, which we are seen to have, or we are asked to believe exists. But that is only across the nation. What is particularly terrible is that the areas of deprivation in this country are such that those figures are doubled and even trebled in some of the poorest areas. So you will find a borough like Haywood in Liverpool, which is something like 40%. And that is just very poor, badly off families eating very poor, bad food for subsistence and not getting any kind of help to pull them out of it. And of course, worse still, those children, if they haven't already acquired the beginnings of diabetes type 2, will go on to become obese adults, which is why the adult figure is so much higher. And they will then continue and not just have one disease, but several diseases. So we have the now old fat people with 3 or 4 diseases as well, which of course is just impossible to cope with.
Is this obesity problem something that affects the disadvantaged people a lot more?
Disadvantaged in terms of income, yes. The cost, which perhaps you would find sustainable to a large family with 2 or 3 people in it, having to feed them and having to cope with them, without child benefit, without food banks, they would be in a very parlous condition at all. So the further away you go from the affluent borough down to the poorest boroughs, you have this expansion of deprivation, and that is awful. I mean, here we're sitting in Westminster, and you think, hey, Westminster, it's the centre of the country, this is where the Parliament is, etc., etc., etc. But the obesity levels in Westminster, in some parts of Westminster, are as bad as in some parts of Manchester, Birmingham, Liverpool.
How important are the early years in stopping someone from becoming obese later in life?
Absolutely important, and that has never been approached. The government's traditional view is that obesity kind of comes along in school, and so they have used the primary school as their base marker for doing anything. But actually, as I just said to you, 5% of children at the age of 5 are obese. That is a substantial number of children, and they have been getting obese from birth and even before birth. And the governments of all persuasions have never properly looked at prevention and making sure that obesity never gets a start. If you will, obesity is such that we need to be talking about it to children while they're at school, secondary school, and preparing them for the fact that at some stage they will be parents. And it is hugely important for the female, for the mother, to be in good shape before she enters pregnancy. And that is BMI, body mass index of 25, 26, that sort of ilk. But above that, it starts to become very dangerous indeed. And you would imagine that anybody who wanted to stop obesity would actually say, right, that's where we go, that's where we put a lot of effort. But no effort has been put in, despite the number of people who've said to the government, you've got to do something much earlier, because by the stage, by the time the child is 3 years old, if it hasn't learnt about good food, quantity of food, not overeating, it will start to pile on the pounds. And once you put it on, very difficult to take it off.
I mean, with adult obesity, it's obviously the person's responsibility while they choose to eat, how much they eat, etc. But with the children, it's not the same issue. I mean, how can we approach dealing with the childhood obesity?
Well, what is needed, and there were faint signs of this during Tony Blair's administration, personified in the Sure Start Children's Centres, is that we need an environment whereby mothers particularly, who never received nutritional information at school, never were taught about child rearing or whatever, then can be taught by professional staff in these Sure Start centres, and they were very successful. In fact, about 3,500 Sure Start centres were created between the year 2000 and 2010. And unfortunately, they were so successful that the middle classes came and used the centres as sort of coffee shops. And the problem with that is that it kind of eased out the people who really needed the help because they weren't of the same class. And so they felt disillusioned and ignored. Then the Conservative came in, the austerity came in, and everything had to be chopped, 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 chopped. And the Sure Start centres started to be downgraded. And when they were downgraded, unfortunately, then there wasn't any kind of on-the-spot help which could be given without time constraint to the families that really needed help. And they did more than look after them medically. They taught them how to sew, how to cook, because a lot of them had never seen a cooker. A lot of them didn't have a table to eat from. What they do, they depended on takeaways, coming in and eating with fingers, no knives and forks, on the knees in front of the telly. And that is itself a danger, because if you're looking at the television, you're not concentrating on what you're doing. So people were grazing and snacking. And the grazing and snacking was usually by virtue of the bad food. A lot of sweet food, a lot of sugar, and it was just going into the mouth in a sort of mechanical way while they were glued to the box. And the result of that was that they didn't exercise, they ate more than they should have, and therefore they got bigger.
Going on to solutions, who's responsible, do you think, for fixing this problem?
You mentioned just now about personal responsibility. Personal responsibility is important, but it has been pursued relentlessly by everybody who doesn't want anything to be done about obesity. It's the responsibility of the individual parent as to what they provide for their children, etc., etc. And that has been rammed down people's throats, and they have come to believe that it is their personal responsibility, but they're not able to cope, because 24 hours a day you have the advertising industry, the food industry, and all those other industries which depend on getting money from people. Eat this, drink that, eat this, drink that. Every billboard you see, every advertisement on television you see is, this is more delicious than that. And of course, to the people who at a certain level don't have the capability of protecting themselves against that onslaught, it's corporations, if you will, at their worst, incessantly pushing their trade and encouraging people to eat. And of course the food, which is less than healthy in terms of takeaways, it's stuffed with fat, salt and sugar. And those are the three main factors which we really have to worry about in the future. We've got to be dramatic to reduce the levels of those three ingredients as much as we can. Now, the attempt in 2018 by George Osborne was to reduce the sugar in terms of fizzy drinks. All the fizzy drinks which were being sold, and energy drinks, full of sugar. And they were delicious, and they were refreshing and cool. And people used to buy bottle after bottle after bottle after bottle. There are people who said they couldn't exist without 16 cans of Coke a day. And that was an enormous amount of sugar. And it was delicious and very attractive. And children will fall for that, particularly, but also adults too. They'll go to the gym. They'll do a big workout on the gym. They'll come out of the gym door, they'll go to the vending machine, press the button, and bingo, out will come a refreshing drink, but it's got a lot of sugar in it. And that will then actually not help them as much as simply water, and it'll stay with them. And so we've got those three ingredients which are so important to take out of the foodstuffs and drink, and George Osborne did it. He gave industry, the drinks industry, 2 years in order to reduce to the lowest level they could for their brand before they would have to pay the levy. And there was a tiered system. And if they reduced the level below 5% per 100 grams, then he didn't pay. Then there was another level, and then the top level. And industry didn't want to pay that. It was not a tax, as was also seen to be believed by the press. It was not a tax on people. It was a tax on the industry, or an incentive, if you will, for industry to reformulate, and had nothing to do with income tax or any of the other taxes which you and I have to pay as a thing. But industry understood what it was about. And as it's so successful that even after a year, people were saying, hey, this is working. For the first time, government has actually taken the initiative and said to industry, we have a problem, you are part of the problem, we are going to encourage you to sort it out. And we are going to encourage you by hitting you in your pocket unless you conform. And industry thought that was a no-brainer. And only 2 companies, Coca-Cola and Pepsi, did nothing. They wanted to keep their original brand, but Coca-Cola, for instance, then came right down to zero Coke, and they are making more money now than they ever did when they had that one brand. And so they're laughing all the way to the bank. And it was a great thing, and it worked. And it took 2 years. It took 2 years because reformulating is sometimes a difficult process. But you can take sugar out of liquid far more easily than you can out of foodstuffs. So if we're going to do anything now with foodstuffs, as a lot of people are champing at the bit, it's going to take a long time because it has to go through various stages, because it has to sell. So the company will reformulate, and then they will test it in the marketplace, and they will go back and say, did you like that? And if it was, maybe you could do a bit more of this, a bit more of that. And then they go back to the drawing board again. So it's going to take at least 5 years for anything to really take effect. But it has to be done. And our fear particularly is that no government so far has taken that step, and we hope that the new government, it's got a lot on its plate, will actually buckle down and do something about it. I say it's a hope, it's a wish, but I have big doubts.
So when that sugar tax levy was first aired, people were quite against it. But later on down the line, we can see it worked for everyone. The companies made more money and people were healthier. Do you think there's a lesson to learn there?
Absolutely. Behavior change takes a long time. And when it was first announced by Osborne in 2016, the press came down heavily on him and said, the public are not going to like that. People will not pay it. And he had a hell of a time to try and persuade people that it was not a tax on the individual, it was a tax on a company. And that it would take time, 2 years, to sort it out. Now we've got the sugary drinks levy behind us, we can much more with confidence say we will now do something about taking sugar out of foodstuffs, but we will give more time for that to happen. And I think at that stage, if it's properly presented to the press, to everybody else, people will now start to understand, hey, yeah, that worked. So why don't we do it? So the tipping point, if you will, has passed. And that if the press are sensible, they will actually be sensible and say to their readers, this isn't a tax scare, this is something designed, which has worked, and actually will help you in the end. We'll have to wait and see whether that happens. But the industry will never do it voluntarily. And the reason for that, if somebody does it voluntarily, they will scoop the market. And they want a level playing field. So they want legislation which will say, this is what's going to happen. It'll happen on such and such a day. these are the penalties that you will be looking at if you don't meet the objective, and everybody will know where they are, and certainly supermarkets. And the supermarkets have been the leaders in having a level playing field. They want nothing more than to ply their trade equally with all the other industry and all the other marks. I hope, you see, I'm an old man, I hope that I'll still be around to see the day, but I do have my doubts. 5 years is 5 years is a kind of a possible figure. It could take longer, but it's going to be several years working out with industry what those 5 years are going to do when they start, because the huge arguments will reign, because there will be some of the industry who said, no, 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 we don't want any of this, and some industries will say, yes, we do, and so there will be a wrangle. But I think that the idea that the industry can do things on their own is blown out of the water, because in the mid-2010s we had a thing called the responsibility deal. And the responsibility deal was the Conservative administration way of saying, we want to cozy up to you, we want to include you in the networking and the various committees that are overlooking food in this country, and we want you to pledge to do these things, and we will work in tandem. And industry said, terrific, but no legislation. No, 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 we won't consider legislation, said the Minister for Health. And so they joined the committees, and unfortunately they manipulated the committees so that nothing really serious happened. So we can't have the responsibility deal again. And the worst thing, of course, that the responsibility deal did was to send the salt targets through the roof. The salt targets were arrived at with the salt industry, or the use of salt, back in 2004. And they set various stages. Every so often they would take a little more salt out. And it was something like a 15-year span to go from the amount of salt that we were eating as a nation, which was something like 12%, 12 grams per 100 grams, right down to 3 or 4 grams, which would be the optimum. You had a large time frame, and it began well. And then, unfortunately, because the whole structure of the Food Standards Agency was obliterated in 2011, the food industry said, well, nobody cares, and we're still now consuming far more salt than we ever should be.
Putting aside the sugar tax levy, what other solutions do we have at the moment that are working?
None. I mean, the latest strategy. There have been about 4 very good strategies which have been presented to the governments, and they have not been acknowledged in any shape or form. The first one was in the year 2000, when the National Audit Office said, we've got a problem, we've got to solve it. And they wrote a long document, which was a government department document, and they identified a whole number of areas which needed to be addressed. Ignored. Then in 2004, the Health Select Committee of the House of Commons did a year-long inquiry into obesity and came out with another document which had 56 different recommendations that needed to be addressed. None were addressed. Then again, we went to New York, or the UK government went to New York at the top-level meeting with the United Nations on non-communicable diseases, and another document came out, produced by Australians, because this was an international event. And they said, these are the things which need to be done. And by the way, if you do them properly, you will actually cost save. They will pay for themselves over a period of time. Nothing, no attention. The government, all the way through from the year 2000, has never taken obesity seriously. And finally, the one which I particularly admire was a document which was written by Dame Sally Davies, who was the outgoing Chief Medical Officer for England. This is the first year, I think, of Boris Johnson. And he said to Sally Davies, will you write down and seriously write down all the things which need to be done? Because at that stage, Johnson had come out of hospital and he said to everybody, I want to now put the fight obesity because I've had such a near-death disaster. I want particularly to halve childhood obesity by the year 2030. And he gave this to Sally Davies 3 months of concentrated work, and she came out with a document which included all the issues which he said needed to be addressed, 84 of them. And if I may, with your permission, illustrate the point by holding up the list that she came up with. Now that, all the bits which are covered in red are the things which he said needed to be addressed in order to do something about obesity. And I mean, it's a brilliant piece of work, and again, it has been ignored. And what the Labour government has got to do, must do in the next 5 years, is to look at this, or even forget the 5 years, 5 days, look at this and say, right, we are going to do something probably at the top end and then work all the way down to the bottom. Because, as I say, we're losing $198 billion a year, pounds a year, and that is a huge loss to the United Kingdom. We are losing money hand over fist every day, and if these are not addressed, we will become 50% obese by the year 2050, and that was predicted by a government department in 2007. 50%, half the population, over a BMI of 30, waddling around, not able to work properly, so there's loss of production, all the costs that go with it. And how anybody faced with that can say, all we're going to do is to have no bog-offs, no buy one, get one free, we're going to have no advertising of high fat, salt and sugar consumables. That by itself might have a tiny effect, but it will certainly not solve the problem. And this has been around for 5 years, the entire length of administration in Westminster, and nothing serious has been done about it. It is a tragic situation.
But what do you feel the government could do?
Well, the government could do many, many things. And one thing that it can do is to, now we're free of Europe, we can change all our rules about advertising and labeling and things. And you can have, as has been mentioned, you can have what they're doing now very successfully in South America, is to have stop signs, a sort of hexagonal traffic light, if you will. And certainly in about 15 South American countries, particularly Brazil and Mexico, they have these now on the packets of all those foodstuffs which have got a high level of salt, fat and sugar. And that is working. And that can be done tomorrow. The government can say, right, what we're going to do now, you will, no reformulation whatsoever. All you've got to do is to print now, if you have 35% grams of sugar in 100 grams, that is far in excess, you will have a stoplight. Again, I'm sure there will be uproar. How can you possibly do this? People must be free to choose what they want to do. And every time they say that to me, I say, well, what about seat belts? Seat belts, none of us wanted to. Everybody revolted about the idea of seat belts, but the government said, it is going to happen. It did happen. Now, you and I, we sit in the car, the first thing we do is to strap ourselves in, because it was presented well, the danger to the country that if we didn't have seatbelts on, and everybody understood it. And it really is in the presentation of how the government puts these things across, how the press picks them out, and how they transfer that to the minds of their readers, which is so important. The Times, I happen to base most of my work on the Times. It's to me, a very good newspaper. The Times asked me a couple of weeks ago to write an article on taxing. And I went through all these things that I've been mentioning to you. And so the Times said, okay, fine, we will allow you, we will allow Christopher Snowden, who is the director of the Institute of Economic Affairs, we were to make the case for and against. And we were given 400 words each to put our cases. And because I'm an old, wizened, reasonable man, I hope, I laid out my case. Snowden laid out his case. And the results, which are coming out very shortly, are that 69% of people are now of a mind to accept that there must be these draconian, stringent measures put in place by government, and only 31% said, no, we don't want any of that. So I think very, very gradually, and things take a lot of time to work their way through, very gradually people are starting to understand that actually we have been done a bum rush by industry, essentially, for too many years, and we have done the bidding of the fast food shops, whatever. We haven't prevented fast food shops opening, despite the fact that local government says the centres of all our cities are now full of chicken shops, of fried food, and that is good for us because it provides employment, etc., but awfully bad for our services locally and particularly for our health services. So I put my case to the readers of the Times, and I'm delighted that in fact I scored one over the opposition to a factor of 50%. And that, I hope, starts to illustrate the way that things are changing. But it's going to take time. And we are now in 2024. I started on obesity 40 years ago. That is the time it's taken. And that is the time that we still are fighting tobacco. We're getting towards the end now. But particularly when government said we will ban tobacco inside, you can smoke outside if you will, but in pubs and things. Everybody said, no, we can't do that. And the government said, it will happen. Now it happens. But it's taken years to do that. Now, the tobacco industry, it's taken 40 years to get this far with the tobacco industry. I would project it'll take another 20 years to get this far with the food industry to a level whereby we will have people going into adult life fairly trim. What happens thereafter is up to them. But certainly it is the children who we must most look at and do all we can to stop them becoming fat. And that, as I say, starts before birth, because that is where the genes of obesity are sown.
We've seen in recent years a rise of these weight loss drugs like Wegovy and Ozempic. Do you see those as a solution?
No. To me it is crazy that we are now spending a fortune on cleaning up obesity, which has cost us a fortune to get to that extent. It is wonderful for those people who are so fat that Wegovy and Ozempic are going to help them. And that is wonderful. But they are few and far between in the scheme of things. What terrifies me is that people are using these drugs. It was intended for the very fat person with a body mass index of 35 plus, with a comorbidity, which is diabetes or something, on prescription, under the care and surveillance of the local GP and the local health services. Because at that point, what happens is that the drug is intended to be taken over a period of time. during which the individual who is so fat will also be helped to go off an extreme measure like this drug and then start to understand about healthy eating and the quantity of it. As a nation, we consume 20% more than we should. So what Wegovy hopefully will then do is to allow people to understand that they were going to lose a lot of weight, but by changing their eating habits and being shown how to prepare food and what is good food and using plant-based food instead of red meat, they will never get back to that situation. But unfortunately, the way things work, these drugs are now available on the internet. And you go to the internet and you can say, right, I want a packet or 3 packets of Wegovy. They're very expensive. I can afford it. I want them. But lots of complications have been started to be shown. And the latest information on this is that there is some element, some research showing that the drug causes suicidal thoughts. This happened 20 years ago with a drug which came out in 2001, 2002. And everybody said, this is the answer. And unfortunately, it was then taken off the market because of people complaining about suicide. The other thing that the semaglutide, which is a Wegovy drug, will have an effect on is your visual appearance. And people are starting to have jowls. So they're losing weight, but they're starting to be, if you will, their whole physique is starting to change. And I don't think you and I want to walk around with a lot of jowls on. These drugs are not the solution. The solution is to get to the person before they ever need to take them. And the solution is to make sure that pharmacies don't sell them like sweeties over the counter. And they will only do it under the prescription of a qualified medical person.
I wanted to end by just getting an idea of how optimistic you are. If we fast forward, say, 10 years, are we going to be more like America or will we be more trim?
I would say we're probably going to be more like America. I wish devoutly that the Starmer administration will see that list of things to do from Sally Davis, and they will start to enact things. And they will look at these other strategies which I've explained to you, and they will take doable things there, things that can be done without a great amount of expense. The labeling, the packaging, and all those things, which will allow people not to buy a pizza, which is 1,300 calories, because pizzas will then have to be 250 calories in a sitting, if you will. So all these things can be done, but they've got to be done, or start to be done now, and maybe in 10 years' time. We won't be like America, but I'm afraid we may well be. America is now starting to see at least 3 states with 80% of its population overweight or obese. We just can't get there. That is unforgivable if we get that far. And I hope that then Starmer and Wes Streeting will actually settle down and say, these are the guidelines for the solution. We will start to implement them now. But it'll be more than one parliament. Could be 2 parliaments. Some have said 2 parliaments for things to happen. That's what we're looking at.
Tam Fry, thank you for joining us.
You're welcome.